This is quite a nice paper which looked at whether giving a lower dose of HCG along with a bolus of FSH would give the same quality of eggs and mature eggs in an IVF cycle when compared to giving 5,000 or 10,000 of HCG. Now, what did this tell us? It told us that in a study where they randomized 1,500 of HCG with a bolus of FSH of 450 and then compared it to 5,000 or 10,000 of HCG, and the number of mature oocytes were very similar in a non-inferiority trial, and the number of 2PN embryos was also very similar. And what it tells us is that by giving a lower dose of HCG and we're giving a rise of FSH, and that's exactly what a bolus does. Unlike with HCG, where there's no rise in FSH, HCG mimics LH, and that rise of FSH, even with a much higher dose of FSH, seems to give the same quality of eggs. And in fact, if you look at the earlier studies where before giving the analog trigger, there was a use of giving a higher dose of FSH as a bolus at the time of trigger, and that increase of FSH probably may be helping eggs to be more mature, and that's a presumption. Now, what we also know is by this you'll be able to give a slightly lower dose of HCG, and this in some cases may be able to help the the rise that occurs with FSH and the additional HCG may help in getting better quality of eggs. Thank you.